Good afternoon. Let's call our HR meeting to order. We do not have any citizens wishing to address the committee. So what I would like to do is to move the items under 3 until we come out of closed session. I want to make sure that we have enough folks for our discussion and an item we need to vote on. So I would like to go into closed session now. Good afternoon. We will reconvene in open session for the HR committee. And I will go back and start with our items, starting with our minutes. You've had an opportunity to read the minutes. Are there any corrections? There being no correction, I'll entertain a motion for approval. All right, it's been motioned and second. All those in favor signify by saying aye. Aye. Next on the agenda is approval of the hospital district policies and procedures. Did you want me to, you're gonna do those, or you want me to do them? Okay. We'll start with HR timekeeping policy. Are there any questions or something concerning those? There being none, can I get an approval for, okay? All right, it is approval by Ralph, second by DT. All those in favor of the timekeeping policy signify by saying aye. Aye. The next, we have our compensation policy, philosophy policy. Are there any discussions or questions on that? All right. All right. Approval by Ralph, second by Trent. All those in favor signify by saying aye. Aye. Next is the shift incentive pay policy. All right. Okay, I have one approved. Can I get a second? Second. All right. All those in favor signify by saying aye of the incentive policy. Next, we have the bereavement leave policy. Are there any questions? All right. All right. All those in favor of the bereavement policy signify by saying aye. Aye. On-call, callback pay policy. Are there any questions? All right. Ralph? Okay. Chuck, approved. Second. All those in favor of the on-call callback policy signify by saying aye. Aye. Reclassification policy. All right. All right. Ralph and Chuck, all those in favor signify by saying aye. Aye. We have one more, shift differential policy. All those in favor? Oh, you move approval? Second. All right. All those in favor signify by saying aye. Aye. Okay. I would like to go next to our annual incentive performance matrix. Bill, do you want to? And then after that, we'll do our stuff.
Jeff, you have this up?
I hope so, because all my batteries are dead.
Okay.
All my batteries are dead.
Okay.
Both machines.
There we go. There you go.
All right.
There
Okay.
you go. Okay. Purpose of my part today is to update you on the 2017 incentive plan and let you know where we think we are, at least fiscal year to date. We're going to also talk about a proposed fiscal year 2018 plan. And we're recommending that we perhaps consider changing 2 of our quality metrics because we have done a reasonable, more than reasonable job to improve those metrics over the last 2 or 3 years, especially when you look at the observed versus the expected rate in regard to falls with injury and caughting. So that just gives you an overview. Most of the other things there, with the exception of hospital net operating margin inclusion in the stewardship area for 2018, everything else kind of remains the same. 2017. The quality metrics were caughting and falls with injury. You can see in the first column the fiscal year 16 result. You can see the fiscal year-to-date result in the very last populated column. That's where we anticipate that we're going to end the year unless something unforeseen happens over the next 2 or 3 days. But we would hit target for reducing CAUTIs, and we would only have one fall with injury, which is below the stretch but above the target goal. Ambulatory care, we've tracked this particular indicator forever. It's the days to next third available new patient appointment. You can see that our performance metrics were 4, 5, and 8, I believe. We think we're going to do better than 3. In fact, I was told in August that 9 of our clinics were less than 25 days.
That's incredible.
So if we continue at that pace in September, it will probably raise the fiscal year average to 4, maybe 5, don't know. But we're going to increase the expectations in that particular indicator next year.
Adding the new acclaimed physicians hopefully will help that as well.
It will. And
So I'm optimistic.
defining template expectations and showing up for appointments and recruitment and use of mid-levels, you bet. You bet. I think we can make a tremendous impact in access. Patient experience, perception of care. We have slipped a little, which was not unexpected to the organization. After you rise as fast as we rose from a percentile ranking, the organization that we use to track this and survey this told us, don't be surprised if next year you can't sustain those results. Now, this is August information that you see in that far populated right-hand column. We're doing a little bit better in HCAHPS. We will not know the final in any of those categories until sometime in November. So at November's meeting or December's meeting, we'll bring back the actual final results for each of these performance metrics. Finance, DSRIP, we are going to exceed 90% easily, even though our target was 85%. And productivity, FTEs per adjusted occupied bed, we talked about that in finance. We probably are around 5.93, 5.92. So we've done really well. We just concluded our engagements survey with our staff Tuesday. I think we had 91%? 93% participation. 92%. That's in excess of where we were last year.
There are some hospital networks, because I've been around and asked, that are really excited when they get 65%. And to get 92% on a non-mandatory deal is pretty amazing. I'm incredibly proud of it. And like I've said in town hall meetings, if you're talking to us in a survey because you don't think we're doing as well as we should, that's communication because you care. If you're telling us you like what we're doing because you like working here, that's great too. It's all good when you get that kind of comment.
Okay.
So that's where we are in 17 today, and that could change a little bit in one area or another, but we'll certainly bring that back to you, and we'll begin reporting this to you every time the HR committee meets. We'll give you an update on HR performance and incentive performance. What we're recommending for 18. When you look at the observed expected ratio of some of our patient harm indicators, the one that really jumps out from the page is surgical site infections. And we've been fighting that for some time as well. So we're going to recommend that we look very closely at abdominal hysterectomy and colon surgery site infections. And you can see what we anticipate ending the year at, and whatever that actual number is, the threshold would be -1. So if it's 13, the threshold would be 12. If it's 15, the threshold is 14.
Okay.
And then we have a 30% improvement and a 50% improvement. I'm sorry.
Bill, and Chuck, what makes those two surgeries more representative of surgical infection rates than, say, picking a central line infection rate or other surgical suite metrics?
If I'm not mistaken, and Mona in the back can correct me, I think this is, these are two procedures that are tracked nationally.
Yeah, they are.
And we can
This is a big
compare
deal.
our performance to others quite easily.
Okay.
And they drive that leapfrog.
Right. It's one of the 30 leapfrog metrics.
They're also there because nobody can really get a handle on what are the problems.
It's multivariable. There's no doubt about that.
It's-
But when you look at the observed expected, we're about twice where others are. So somebody's doing it pretty well.
It's not a reflection of overall surgery site infections, which are really low. These two are high
Okay, thank you.
nationally, and we're above the national average.
Thank you.
Just so you know, Bill, Mona agreed with everything you said. She was shaking her head.
She has coached me very well.
She was checking her fit.
The next one is access. Again, we're going to look at the days to next third new patient appointment. Whatever the actual ends up being in 17, we'll add one to that for threshold. But we certainly think that we can do much better than where we were this year. We are on a significant glide path to improvement. The perception of care scores, we're going to continue to track those. You can see what we're recommending as threshold, target, and stretch for next year. And that is dependent upon where we end up the year as well. But I think those are reasonable performance improvement metrics that we can strive to improve upon. We're going to leave the productivity at the FTE level, although we're going to decrease the performance metric. But we're going to suggest that we add hospital operating margin. And the discussion that was taking place in finance was very appropriate because we are subject to so many financial uncertainties. We could just as easily have an upside next year as we had the downside this year. We don't know. A lot of that is not within our control. But we still as an organization want to strive to at least meet our budget, which is 0.4%. It's razor thin. We know that. But there is an incentive to do even better. So to the extent that we look at efficiencies and productivities and consolidations, we might be able to improve upon those margins.
But Bill, to be clear, none of those options relative to that metric would include reduction of service without the board's approval.
Oh, absolutely not.
So I think.
Absolutely
The
not.
point there is, yeah, efficiencies, let's always get better at. But let's also recognize the indiscretionate changes that even if they occur, there's some level of change we can't get to.
Right.
You know, we're not gonna go reduce services in order to make budget, in order to make a metric.
Right.
So.
Right.
In fact, you'll have the opposite effect, and that's what our community and our taxpayers need to
Right. That's
understand,
why we're here.
is that reduction of services doesn't just affect the bottom line in this place,
Right.
because so many folks come in that
Our
can't
community.
afford their payment.
Right.
When you cut services, you don't stop anybody coming from your place. You continue to have that problem.
That's not part of the plan.
It's worse.
Right.
It gets worse.
And this is the one that for discretionary, looking at where we are this year, finance is gonna go back and look at that and come with some recommendations to us,
Yeah.
right? I think that's what we agreed in finance, right? Because of where we are with some of the things
Well,
that happened in
we
budget.
established the trigger, to even play in this plan as the operating margin budget last year, this year, the current year that we're in. As you talked about in finance, there's certainly discretion around that. We're recommending for the fiscal year annual incentive plan 18 to utilize a trigger of net income, a break even of net income,
So
given the
Not
uncertainties.
1%, but even.
Break even for net income, not operating margin, but net income, which is a lower than budget target, but it at least enables the plan to be in play if in fact some of these performance metrics are accomplished.
Stretch is 1% of net income, or stretch is 1% of
The trigger to play in the plan would be break even net income.
What do you mean the trigger?
Well, like this year, for instance,
point we have to make.
there's not a net operating indicator in the plan, right, for 17. The trigger is the operating margin, which was 1%. If you didn't hit the 1%, the plan is not in play.
Okay.
And given the discussion that took place in finance and the uncertainties and the lack of control and influence, even though you hit the performance metrics, you might have accomplished 60% of what your targets were, but you couldn't participate unless the board uses their discretion. Now we're saying, maybe we need to formalize that for 18 and make the trigger 0, break even, using net income, not operating margin, but total net income. And you accrue the expense each and every month along the way for this plan. So the break even would have included an accrual for incentive at the end of the year.
I think I got you.
Okay?
Yep.
So that's the recommendation, and I'll be happy to answer any questions that you might have.
Employee engagement score.
Yeah, we're recommending that next year, we would make a stretch goal of the top decile. We really, really think that we want to strive for that, regardless of what our score comes back this year. And it's kind of like patient experience. We might slip some. I mean, we have accomplished a lot in a very short period of time, and our vendor said you might slip. But in spite of that, we want our stretch goal to be top decile. So the threshold and target would be dependent upon the actual results that we incur in fiscal year 17.
Yes, Fred.
I don't know how to present this or how we would look at this, but I would hope we could meet and come up with a category of it, the infant mortality. I don't know, because there are so many factors that play into
There are.
this. And maybe it means sitting down with Wanda and Pat and kind of looking at the whole picture, but I just wanted these, it be out front at JPS.
It remains a pillar, doesn't it?
It's a destination metric,
Destination, yeah.
and it's one that doesn't move necessarily annually. It's a long-term goal. And it's a multivariable indicator as well, and there's certain things that have to happen. And we could certainly look at JPS infant mortality as we have in the past. But as long as that was a destination metric, we kind of have it. This is not the exhaustive list of indicators that we're tracking. We're probably tracking 50. Probably even more than that, but at least we've identified 50 that we as an organization are going to track. And the destination metrics kind of set the framework. So if you got infant mortality as a worthy goal, in our organizational goals, we're tracking the percent of the visits that occur within the first trimester of pregnancy. That's a goal that everyone in Wanda's nursing division understands. And to enable us to do that, we need providers. And we have vacancies in our OB-GYN department. So part of the plan to address that is recruitment. So it's not as if we're not tracking that and making that an organizational initiative, but it's hard to move some of those indicators on an annual basis. Thus, that's why it's not part of the annual plan.
The other challenge, Pastor, on that one and why you don't see that there and you see it in the destination metrics category is, if I'm not mistaken, I can't remember, it's a year or 2 year lag time from the county on
I think it's a 2 year
mortality
lag.
numbers. It's 2 years
From the state.
from
the state.
state.
I mean,
And
you
so
can't do-
it's hard to put it in a year program when we're always behind with numbers significantly. We don't control, but we get these numbers instantaneously in oftentimes cases. I mean, you can almost look at this like the stock market, and you can look at it every day. But the infant mortality numbers are a little more difficult to fit in that square. That's why we put it in the destination metric category. So it doesn't fit as well, but I mean, it's definitely a key component to what Bill just spoke about as a destination metric, what our team does and how we try to get there.
If possible, we can sit down and have a conversation.
Sure.
And I'll some suggestions.
Sure.
We can look at.
You bet.
on JPS.
Okay.
This would be a good one for Roy.
That's exactly what I,
Quality
Yeah.
mhm. 'Cause
Committee where it's not
Quality.
necessarily a metric, but something that.
Quality.
Recorded.
yeah, I was gonna.
We can talk, we'll look at all that. We were excited to do it.
For us to impact the whole county.
Right, but just to get a handle.
Because otherwise, we don't see the movement. It's kind of-
Well, and that's why the last numbers we showed y'all in the big increase were the JPS numbers.
JPS specific numbers.
And when you went from a 8.6 to, yeah, we had significant movement in JPS. I don't want to misrepresent the numbers, they're not sitting in
Right.
front of me. But that's why we can calculate just JPS's role in that. But you're very worthy of a discussion on it.
But,
Because
yeah.
I would somewhat disagree with DT. I think that you can impact the county from a JPS perspective. You just have to look at, when we
How?
look at county.
Mhm.
okay? But I'll just sit down and talk about that.
But I believe that some of our destination matrix can be followed in quality a little bit closer, and we can get some more
Absolutely.
information.
Yeah.
Specialty clinic is not on here, but that's one that we're gonna be following in quality because it's so, access to specialty care that's just one that's so critical to care. So that should be one that, and I'm gonna ask Roy if that would be something that he would be willing to have them present at quality every so often on that, okay? Any other questions for? Good job, Bill.
Thank you.
Okay.
Need to vote on that? Are we voting on that?
For 18?
For 18, yeah, I think, I wasn't gonna vote on them now because I was gonna wait for the numbers to come back, then you'd actually have the true numbers to vote on.
Okay.
But,
That's fine.
what I would like for us to do before I lose my quorum is for us to come back and finish up with our recommendations for, she was, well, you were there, but she was gonna do an HR dashboard, but I was gonna finish up with our closed session recommendations that we need to come out, we need to have a vote on.
That's fine.
So we was doing Robert's evaluation, and so we had some recommendations, so. Don't everybody speak up at one time.
Madam Chair, we'll let you.
I'm entertaining a motion for us to approve for us to move forward and bring in the CEO salary up to the medium within the next 3 years. That was one. And the second part is that we would have a board retreat. Okay? So can I get a motion?
You got it.
Okay?
Second.
All right. All those are there any other discussions on it? Let's be clear what we, okay. All right. All those in favor signify by saying aye.
Aye.
Okay, thanks. All right, now, we're ready.
Thank you. So thank you all for allowing for me to present this afternoon an update on the Human Resources Dashboard. This information is providing to you an update on our voluntary turnover, involuntary turnover, and total in 1 year. As you can see from Q2 to Q3, we did have some trending upward in our numbers relating to our turnover. We do benchmark our data against the Saratoga data. And in reviewing this information, when we did see that the information was trending upward, of course, we do like to look at reasons of why individuals are leaving the organization. The theme is very common with all of those. that are trending upward. And for example, reasons for leaving the organization are voluntary resignation, other jobs, things such as relocation, that's one that's key, and then also education. We do have employees that do make a determination that if they want to move forward to do advanced formal education, that they do resign from their positions to be able to go back to school full-time. So as for us, our focus is to have a single-digit turnover, and that's the ultimate goal for us moving forward for each year. As you move downward, looking at the turnover data, this is year-to-date information for us. Looking at this year-to-date information, one key thing that I do like for us to focus on too is the vacancies. And we have trended very well with our current vacancies. As of to date, we are at 276 vacancies, and most organizations the size of JPS are trending probably about 500 to 600 vacancies, so we're doing very well there. When you look at our annualized turnover, we are at 12.46, but we would like to trend downward, looking at Saratoga at 10.6. So when we look at those two categories,
Let me
it's
stop you and ask you a question
Yes,
about
sir.
that. Roughly, what percent of the voluntary turnover was due to salary?
You know, with that, what I'll need to do, I need to go back and look at that number, and I can follow up
Okay.
on that.
Thank
Yes,
you.
sir. And also too, with that, another key thing that we like to look at too as well is those that are in 1 year service and then the 90-day turnover as well. So again, these metrics, we're benchmarking against Saratoga, our ultimate goal with our turnover data to continue for us to look at being a modern healthcare DFW top 100 workplaces. Turnover is something that we do want to focus on getting to the single digit. Are there any questions?
What's in patient care support versus support?
Patient care support are your positions such as it could be MST, it could be a red tag. It's mostly your support positions to nursing. So it's those type of roles. And then what was your other question?
Support services compared to support
Oh,
services?
support services, those are positions such as your laundry services, those type of roles.
Gotcha, thank you.
Are there any questions? Sure. Pam? Okay, thank you. All right.
Next, I would like to move on to succession planning, development for leaders. Back in June of this year, we did our first presentation for succession planning for leaders. And just to do a quick recap, what our ultimate goal with this project that we're doing for succession planning basically is to develop top leaders within the organization, and then also to have that key talent within our role to plan for leadership positions within the organization. So let's look at the next slide. The next slide provides to us what the current focus is. So with the current focus, we had to collect data, and what that data consisted of was to do a 9-box assessment, a 360, and then also a leadership assessment. Phase 2 with this project was to identify the top performers, and then also from there create IDPs, which were individual development plans. With that, what our ultimate goal and what we promised from the last board meeting was to make sure that we did do this work to be able now to go into the individual development plans with those key top performers. We also have assessed the talent within the organization to identify those high-performing leaders. And on the next page here, what you see is the 9-box summary. And this is something that we presented to you to identify the work that the executive team did during that 9-box summary. The 9-box summary consists of the performers, looking at the high potential and then their performance too as well. With that, this represents 188 employees out of our 261 leaders. And this also includes leaders that have less than 1 year's service. We want to make sure that we identify the high potential leaders so that we do have the talent within JPS to make sure that we can be able to successfully retain our current leadership team, and then also to make sure internally that we have high-performing leaders that are competent to make sure that we have a high-performing workforce as well. Are there any questions before I go any further? Okay. So as you see here on this slide here, this is basically part of our selection process. With that, as you can see for each executive, we identify how many top performers were identified for us to be able to go through that 9-box assessment. For some executives, they probably had 3 to 4, depending upon the size of their division, and for some of them, we have 1 based on that. As you can see is the average years of age for these top performers that were identified, and then also to their tenure within the organization as well. So what did the assessment process look like for us? So for us, we have identified 34 key top performers within the organization, and this has been a very positive and great process within the organization. What we did with these individuals, we did interviews with their executive leaders, which consisted of a 360, which consisted of information from their direct reports and their superiors as well. Then we also interviewed the top performers as well. This was time for us to sit down and be able to gather information on what has made them a top performer in the organization. What were some of their strengths and what were some of their opportunities as well for them to improve. And then we also looked at doing a 360 feedback with their executive leader on how we can assist for them to be able to move forward, to be successful in their roles, and then also too, what are those key opportunities that we need to focus on with these individuals as well. So what are the next steps for us? The next steps for us basically is for us to sit down with these 34 key performers, focus on their individual development plans, and then from there, once we do this piece, it will be continued meetings that we will do with the leaders and these employees relating on the focus for these employees so that we can have the internal strength within JPS. Once we finish this phase within the leadership team, what our goal is to move forward and cascade down to the organization to build succession planning. Some of the key questions that we think about for us as an organization, the purpose and wanting and making sure that we do have successors in the organization, top performers, is because, again, I can't emphasize the piece of, as for us, we have one, best places to work, DFW top 100 workplaces, and this is the way that organizations look. They build their talent, and they ensure that they have individuals who are competent in their roles to be able to lead the organization forward. So our next slide here is basically providing what the timeline will be for the rollout to all JPS employees. As you can see, for us right now, we are still focused on the leader model and working with those 34 key individuals to assist us in providing feedback to other leaders to build their success to JPS as well. Our goal is to have this completed in 2019 with having this cascaded down to the entire organization, to our frontline employees on succession planning and development. Are there any questions?
Yeah, what determines readiness relative to that? Is it just the time that we worked with it, or is there some assessment that today, out of those 31, there are 6 that you would say are ready now?
Right, well, the piece is that it's looking at the timing, is when we bring those individuals in, looking at their competency, doing a 360, sitting down with them to find out what are their strengths and their opportunities to be able to move them forward. So it's the timing, and then we have to do that entire exercise too with them to determine.
So no matter where they are subjectively, until they have objectively gone through that process, they're not deemed ready now?
Right, exactly. Yes, sir. Yes, sir.
So I've gone through the process, and I've been trained and all of that.
Mm-hmm.
Am I guaranteed the next level if it comes over?
It's not guaranteed, it's based on performance. So the key thing that we do not communicate to anyone is guaranteeing them employment. For an individual is that what we want to do. For some of these individuals, we want to expand their knowledge and their KSAs, their knowledge, skills, and abilities in their current role. But if a position comes open, we're not guaranteed that they're going to be moving in. We still need to assess their talent to make sure that they are ready for that position. So when you're doing succession planning and development, it's to strengthen their competencies in their current role. And then also, if another position does come open, are they prepared to come into the other role? So when you look at nursing, nursing had 5 individuals that were taking through this process. So if the next level position comes open, where it's an executive director, all 5 of these individuals may apply for that position, and then from there we'll determine if they're the right fit for the role. For some of these individuals, they don't want to move to the next level. They just want to strengthen their ability to be key in their current role.
I'm surprised out of 5,000 employees, we have 31.
Yeah.
Well, this is leadership only.
So what's the class, what is the size of the class that this was taken from?
Well, the group that we looked at within the leaders, we assessed 188 out of the 264 leaders.
Okay, and
So
those were the new ones, right, they're less than 1 year?
Yes, sir. Mhm.
So 31 from that group were deemed, okay.
High performers.
Is there any process by which those people that are not in quote leadership are measured toward succession or toward?
Yes, and that's our goal for 2019, to focus on the frontline employee so that we can cascade down. So right now, because we are a large organization, we're doing a phase approach. And the phase approach was to start with leadership and then cascade down to the front line.
Okay.
Yes.
I think one of the deals that I'm happy to hear that is that when we look at our turnover, it's a lot of turnover right there with the management staff. And so I'm thinking that really hurts you when that group leaves. So those would be better educated and skilled to move up. And then the supervisors up under them will be the next one that they do.
And then also, too, another great thing to focus on, too, as an organization, beginning October 5th, we have education sessions and a curriculum built for leaders that are new to leadership roles, and they have less than 2 years, and it's new to leadership. And then we also have a cohort built for team leaders and supervisors to assist them with their leadership as well.
Anyone else have any questions
I
of
was
Pete?
gonna ask a question for Trent. Did you think the number was too low?
Well, I wanted.
He was comparing it to the whole
I was looking at the
organization.
entire organization. I hadn't picked up on the fact that we've only started at just that leadership group.
188.
So I'm glad to know that we've got a plan.
There are more than
that cascades
31 and
all.
6,500.
Right, exactly.
That's why I was asking.
Probably a little bit of a low ebb.
Okay. Any other questions? Thank you, Pia.
Thank you.
I'm very proud and happy to see the succession plan.
Thank you. Thank you.
Great work.
Okay, good work. Okay. Next on the agenda is the diversity and inclusion. Okay. Yeah.
Thank you for noticing. I am without my boot. Thank you. Let's see, so I need to, there we go. All right, so. Okay. Can you hear me okay? All right, good. Okay, so I want to start out by saying that since day one in the Office of Diversity and Inclusion, the work of our office has been guided by 5 principles. The first principle is complete support of board and senior leadership. The second principle is that we must know where we are today, what's our current state of diversity and inclusion. The third principle is what's our desired state? When will we know when JPS is a culturally competent organization? The fourth principle is how do we get from our current to our future state, i.e. the roadmap, the strategic plan. And then the fifth principle is integrating diversity and inclusion into the overall JPS strategic plan and other ongoing initiatives. I want to recognize Mr. Early. Is he here?
I am.
Okay, thank you.
I would not leave you.
All right, thank you. Yeah, I want to actually thank Mr. Early for his support. That's that first principle, complete support of senior leadership. I want to thank him for supporting our office when we recommended that we do an organizational assessment and a supplier diversity assessment so that we could define our current state. I also want to thank you, Mr. Early, for hosting the Diversity Summit, where we learned about the findings of our assessment, and then also set the strategic direction for diversity and inclusion at JPS. Now, Mr. Early is a visionary, as you all know. I mean, you've seen the transformation in the last 10 years of JPS's journey. And one of the things that Mr. Early recognized early on is that an organization's efforts to advance diversity and inclusion requires governance. And so I'm happy to report to you that on May 18th of this year, Mr. Early launched a diversity council comprised of executives. On the council, there's 6 of us on the team right now on the council. They include Gina Adler, Tricia Elliott, Wanda Peebles, Scott Rule, Pia Walker, and me. And Mr. Early chairs this diversity council. And the purpose of the council is for us to use data to set strategic direction for diversity and inclusion and to oversee diversity and inclusion programming and initiatives and to review those results. And so I just wanted to highlight that first principle. In order for diversity and inclusion efforts to be successful in an organization, that first principle is a critical success factor of having complete support of senior leadership and board as well. So thank you, Mr. Early.
You're welcome.
So you've seen a lot of numbers today, and you're going to see just a few more before the end of the day. But I want to start out by asking, does anybody know why 6 was afraid of 7? Do you know why 6 was afraid of 7? Because 7, 8, 9. You get it?
Okay.
Because 7, 8, 9, right? Ta-da-ta. Okay, that's fine. Well, I thought, it's late in the day.
Anything's fair.
Anything, okay, all right. Well, thank you very much for just letting me, have a little fun. Okay, so let's look at some numbers, right? Okay, so one of the things that we measure in diversity is representation, and that is by asking, do the demographics of our workforce represent the communities that we serve? Okay, and so you can see by these graphics here that we do, in fact, have pretty good representation reflecting the demographics of Tarrant County. Now, there's some areas where we do have some underrepresentation, for example, in the Hispanic or Latino demographic, and also in some areas where we may have some overrepresentation, for example, in the Black or African American demographic.
What is one, just the other race and other?
Yes, so when the workforce self-identifies their identity in terms of ethnicity or race, one of the options is 2 or more races or just simply checking other, right? Because they may have multiple identification. That's right, right, okay. So the other piece of representation is, do the demographics of our workforce represent the patient population, right? And we do, in some aspects, have a direct reflection of our patient population. And like in the other slide with regard to Tarrant County, there are some areas where there may be some underutilization, such as the Hispanic population. And so you may recall, those of you, or even if you didn't attend the Diversity Summit, there was quite a bit of great discussion. It was one of the first things we showed was the demographics, and so the question was, so should the demographics of the JPS workforce reflect Tarrant County, or should it reflect the patients, one or the other, or both, right? So these are one of the metrics that we have in terms of representation. All right, the other area I want to touch on for a bit is the education and training that our office provides. One of the things we've been measuring is the number of participants that we're reaching in the JPS workforce. And we're about 6,500 employees, and this year, fiscal year 2016 rather, we've reached just under 3,500 employees in diversity education. And the content of the education curriculum depends largely on the target audience and also on the need for training. And so what you see on the right-hand side are departments that have reached out to us and say, we have a need for diversity education. We go out to their departments, work with their leadership and others in their department and say, tell us more, and then we custom design and deliver education depending on the target audience and their need for training. Some of the, you can see that just over in 2016, 20 departments engaged our office for education, and I guess over a year's time that averages to about two departments a month. Now, every month, every other week, there's new member orientation, and we have a diversity session in that. So the numbers that you see also reflect those new employees coming through new hire orientation, as well as the managers of people that participate in our Leadership Acceleration Program. Okay. So it's one thing to measure the number of employees, right, participating in diversity education. That's one metric. It's also important to measure the diversity knowledge and skill that's being enhanced as a result of participating in education. So we ask questions like, has my attitude towards diversity changed? Am I more confident in my diversity skills? Can I demonstrate behaviors that I wasn't able to before? Do I know more about diversity? And so one of the things that we've started is we ask participants to fill out a pre-training survey where they assess their perceived knowledge and skill of the content for that diversity education session. And then immediately following the education session, we ask them to complete a post-survey. And so we're able to measure if increased knowledge and skill has occurred as a result of training. We've had, on average, a 27% increase based on the pre- and post surveys that are completed by the participants. And just some of the sample survey questions are, I can articulate the definitions of diversity and inclusion in ways that are linked to our mission and to organization results. I have tools for identifying behaviors that enhance or detract from a positive, inclusive working environment. I have a plan to more effectively recruit, hire, retain, and engage talent. And I know appropriate and inappropriate ways to demonstrate care and compassion to homeless patients.
So then let me ask a question.
Yes, sir.
This reflects those that were the participants, and the participants were the previous slide. Would you go back a slide?
Mm-hmm.
Is this the participants in the 20 departments that refers to?
These are the participants that have come through new hire orientation, that have come through the Leadership Acceleration programs, and that have asked us. Now, where we do the pre and post is in the Leadership Acceleration program And we also did it with a session that we did serving our homeless patient
The
population.
question I'm getting to is what are the departmental requirements across the board relative to required diversity training?
We do not have required diversity training.
What's the thought process in that?
That would be something that the Diversity Council is going to take up as a consideration. Should we mandate diversity education at a minimum for managers of people, right? We do have it in new orientation, so they get a session right away on the first day on the job. Some organizations have required education depending on who the audience is and what the content is and the need for it, and some organizations don't. I've been with organizations that have both. Some curriculum is required, some it's not.
Okay.
Mhm. Thank you. Okay, so one metric is, right, the number of participants that participate in diversity education. Another is those pre and post survey I just showed you, is knowledge and skills being increased. Oops, I didn't change it. There we go. And so yet another metric, an additional metric is that increased or enhanced diversity knowledge and skills making a difference, right? And so one of the metrics that we're using is the employee engagement survey. So you heard earlier about our employee engagement participation. And now recall that the employee engagement survey has a number of components, a variety of components that includes information on compensation, on benefits, on teamwork, on leadership, and we also do have 2 diversity indicators in the employee engagement survey. And so we ask, one statement is, I feel that JPS Health Network is a diverse and inclusive work environment. And the second one is JPS Health Network values employees from different backgrounds. If you look at our scores for the diversity engagement statements, 4.44, 4.42, right? They are higher than the overall score. One of the things that Ms. DeBose was interested in is, so how does that compare to the national healthcare average score? So we asked Press Ganey, who sponsors the employee engagement score, to give us some data from their database. And they measure only the second statement, right? So that's the one that we could compare. And it is JPS Health Network values employees from different backgrounds. So in 2015, our score was 4.42. In 2016, it was 4.50, right? Their national health average for both those years was 4.24. One of the other questions that Ms. DeBose asked is, well, what's considered statistically significant in a change, either an increase or a decrease? According to Press Ganey, they say that any increase or decrease of 0.05 of an original data point is considered to be statistically significant. So if we compare our score of 4.42 in 2015 to their 4.24, right, we were 0.18 higher than the national average JPS was. Respectively, in 2016, it was 0.26 higher, right? Now, we believe, right, we're making correlations here, that you saw that the numbers of people coming through training in 2015 was 1,947, and you see the scores reflected there of 2015, right, for the engagement score for diversity. In 2016, it was just under 3,500 employees. We believe that the more employees we reach, or reach us, because many of them come to us, those customized departments, right, and participate in diversity education, the higher the engagement score. And that's reflected from that pre and post, right, that's telling us, yes, I perceive that my knowledge and skills have increased as a result of participating in diversity education. Okay, so one of the things we thought would be interested was also to see how the departments fared out, the various departments, right? And so if we look at that second statement, JPS Health Network values employees from different backgrounds, the national average, right, is 4.24. Both in 2015 and 2016, the departments reflected on this slide were higher than the national average. Keep in mind that nursing is just over half of our employee workforce. And you can see their scores, 4.47 for RNs, 4.28 for the others, and you can see the other departments there. Now, I believe that the high scores are due to the leadership of these divisions, and starting with my peers on the executive team. And then subsequently, those people managers that are their direct reports. Okay? Aha, supplier diversity. Okay. So, just to recap, the overall objectives and goals of supplier diversity are to, as you know, to increase percentage spend with our diverse suppliers with a goal of 25% by 2020, to increase the quality of goods and services purchased, and to also leverage local suppliers to strengthen the communities that we serve. So let me share with you some of the things that we've been working on. B2G is the diversity management software that we utilize. B2G maintains vendor accounts, and they also maintain certification records. And one of the things that B2G allows us to do is to reach out by campaigns or RFP notifications to these vendors based on their industry code that they put in the system, and give them an opportunity to respond to that. So what you've seen is we started this in December of 2016. And since that period of time, 71 RFP notifications have gone out, and we had over 26,000 unique views. Now, unique views are a vendor went in there and looked at it, and they might have gone back and looked at it a second, third, fourth time. So we're just counting that one time that they went in. Okay. This is a new feature that we've introduced via the campaign. The other thing that we've started, and this was started in June, right after the Diversity Summit in June of 2016, was to provide vendor education. Okay? And we can do this outside of the B2G system, where contractors contact our office directly. They show up in person without a scheduled appointment, or scheduled appointments, or via communication within the B2G system. We provide 30-minute vendor training sessions, and those training sessions include information about the JPS RFP process and the 25% goal. It includes information about how to register into the B2G system, includes information about commodity coding, navigating and reporting Tier 2 spend. And as I mentioned earlier, sometimes they're on demand, where they just show up in our office or give us a call and we respond right then, or we schedule appointments with them and also conduct webinars as well. Okay. So if we look then at the overall spend numbers, it is important to note that diversity spend for construction projects in 2015 was around 37%, and in 2016 dropped to 31%. It's about just under 20 million in 15 and 7.3 million in 2016, resulting then, we believe, in a reduction of diverse spend.
But you gotta you gotta look at the numerator in that equation too.
Mm-hmm. That's right. That's right, sir. And so one of the things, Mr. Bose, that you asked a while back, right, was you were interested in not only the overall percentage spend, but also what percent of hub vendors are receiving payment under 50K, right? And so for 2015, of that 9.1%, for example, 7.8% of hub vendors received payment under 50K. Just over 20% received payment from 50K to 200K, and the largest payment is over 200,000, 73%. The numbers don't vary too much with 2016. In 2016, of the 8.4% total spend, 6.8% of hub vendors received payment under 50K, 19% between 50 and 200, and again, just under 74% over 200K. So the good news is that, yes, while the large percentage is in greater than 200K, we do have participation of HUD vendors in those other categories.
2015 was still following up on Epic. I mean, that
Yes,
was part
sir.
of the big spend. 2015 was Epic, so it's kind of,
That was 2015.
yeah, exactly, I remember that day.
Yeah.
Can you give the definition of what the diversity office has for spend?
For spend,
Is that the goal for?
yeah, what,
The 25% spend, what is that definition to you?
How do I define diverse spend?
How does that office design, not necessarily you, the office? There's a definition somewhere, I would assume,
Mm-hmm.
that you go by, the diversity inclusion office goes by, that you look at to see if we met the 25% spend. What is that? What is
Okay, so I have members of my task force that are much more apt at defining that, and I would ask for some support.
They all just turn around and look behind them. I love that, the whole room.
No, I really do. They are much more apt at giving you accurate information.
We define the diversity spend percentage with the, if you will, imagine a fraction, the denominator being the entire included category spend, while the numerator is the entire hub spend based on the AP distribution. Now, the numerator also includes all available Tier 2 spend.
includes all of what?
Available Tier 2 spend.
What is the tier 2 spend?
It's subcontractor spend. So an example would be Corgan. We recently launched a pilot. So Corgan is not certified as an entity, but they subcontract with small businesses. So we actually counted how much they paid their subcontractors that are certified.
The 25% spend, so we look at that system-wide, or do we look at that per vendor?
Can you repeat that for me?
When we look at the 25% spend, do we look at that per vendor, or we look at that per system?
System-wide, isn't it?
I would say it is system-wide.
Yeah.
Because you have vendors that supply a wide variety of services, and it depends on what they're providing and where their stance is when it comes to certification.
So do you calculate, or do we calculate that the same when it comes to construction project versus?
That's part of the spend, isn't it?
Yes, it
Capital
is. It is part of the
supplies-
spend.
Capital and supplies
Yes.
are both part of the overall spend.
Yes. So all hubs, no matter if they're included or excluded, are going to go into our numerator. Tier 1, and as much as we can get with Tier 2. Now with the B2G system, we can actually go higher, up until Tier 10, I would say. But we are in the development process.
Give me a tier 1.
Tier 1 is Corgan, Tier 2 is Multitech. That's an example. Corgan and Associates. And Tier 2, an example would be Multitech Engineering. So Corgan actually helped with the Northeast Medical Home building, and they actually subcontracted with Multitech for their project.
And with Compost Engineering.
Compost Engineering is another one. So they're
Contractor.
2 hub contractors.
think part of what I'm seeing in the report is we pulled out the diversity spending for construction projects and said, that's a large number. That's the big volume. And then they did an overall that included construction and everything, and because construction went down, the overall number went down.
I believe construction is greater than 30%, Scott, something like that, of the diverse spend?
Right, as we saw for 2015,
Mhm.
31%.
It was 37.
Because that's most of that over 200,000 going to be in construction.
It's gonna be in construction.
You can see I have very capable staff. Thank you, Mesa. If you haven't met Mesa, Mesa Mwele is our project manager for diversity and has been leading the task force in enhancing our effort. And speaking of the task force, I do want to recognize the members of the task force that represent 16 departments across the organization. They include Michelle Atkins with Internal Audit, Chris Bullum with Contracts and Leases, Arthur Elgin with Facilities Management and Plan Ops, Rick Fry in IT, Lizzie Harris in Purchasing, Irana Hughes in Compliance, Irma Lee in Compliance, Shane Lin in IT, Angie Morgan in Construction, Rihanna Pullard, Employment and Labor, Charlie Ranson in Purchasing, Matthew Schuster in HR, Ben Scott in Finance, Vicky Tyre in Accounts Payable, Joe Velasquez, Supply Chain, Tracy Williams, Accounts Payable, and our consulting third party, the Exeter Group, as well as Michelle Green-Ford and Mason in our office. And this task force has actually been functioning since the Diversity Summit last year. And what you'll see next is their recommendations in terms of next steps to enhance our diversity supplier efforts.
So you know Exeter was still engaged with us toward this effort? I didn't know that.
Yeah.
Okay, so in terms of next steps and recommendations from the task force members, is to launch a JPS Diverse Supplier Purchasing Committee, okay? And one of the things that the committee would be responsible for is for identifying opportunities for diverse suppliers by category, and then also driving the strategy and making sure that we comply and follow policies and procedures. Okay? The other area is to also support diverse supplier capability. One of those is to actively partner with our local chambers of commerce, as well as the certification agencies. We've been traditionally using the North Central Texas Regional Certification Agency, which we do currently use, but this year, as a result of recommendation from the task force, we actually joined two national supplier diversity organizations. One is the National Minority Supplier Diversity Council, and the other is the Women's Business Enterprise Council. And what this does is it gives us an opportunity to cast the net, not only in Tarrant County, but across the state of Texas and nationwide.
Say goodbye to Exeter.
See y'all.
Oh, bye-bye. Okay.
Exeter's exiting.
Yes.
Exeter's exiting.
Okay, all right. And so in addition to partnering with our chambers and associations such as NACI, which is the National Association of Healthcare Executives, we also are currently developing more curriculum for training for prospective suppliers and existing suppliers. And training modules can include how to complete an RFP, determining who buys their product and service at JPS, how do they sell their product or service to JPS, how do they find a diverse supplier to partner with if they are a majority firm, and how can they joint venture with other diverse suppliers to build greater capacity. Okay, and then finally, continuing to leverage the supplier management software with B2G. So as Mason mentioned, we did pilot a Tier 1 and Tier 2 spend, and one of the things that the B2G allows us to do is to see if they're in compliance with the contract. So we we work with with Chris Bullum, who sends us information about the contract. We upload that information into B2G. We see what their subcontractors are and what they said, what percentage they said they were going to award to that subcontractor. Then we have the subcontractor go in and check and let us know, were you paid? Yes, no. Were you paid this amount? Yes, no. And so it allows us to see if our vendors in fact are in compliance with the contracts. And then finally, I just want to bookend again with thanking Mr. Early and our newly created council, which will be our governance for the work going forward. With our organizational diversity and our supplier diversity. So we'll continue to meet department requests for diversity education and to nurturing our community partnerships.
Are there any questions? Yes.
I do have a question, because this is it's very broad and very sensitive subject here, so I'm trying to get a feel of it in a non-political way. I've seen a lot of diversity, and you mentioned inclusion, but I don't see us in that inclusion. So where are we in the pathway there? And there's a big difference between diversity for the employee and diversity for vendor. So in terms of diversity for employee per se, are we trying to match that as a philosophy with the representation of the population as a workforce in that regard? And the reason I'm going there is this, right? I don't see religion play in here when you talk about inclusion and diversity. I don't see gender number in here. You see where I'm going? And then there's a big things between how we view diversity from us being, I'm going to take a number, we all, for me, for over 50, I see diversity differently than the younger generation see diversity, because they kind of blend between diversity and inclusion, because they are going to be looking at, do we move and have more collaboration and innovation? So you'll be looking at background, experience, and perspective, and that covers all the way from inclusion to diversity.
Right. So
where are we on that?
yeah.
Because
So
I'd like to see things not. I'm colorblind when it comes to this.
okay.
I'd
So
like to
first
see
of
that
all,
workforce.
let's define our definition of diversity here at JPS. First of all, there's the primary dimensions of diversity, which include race, ethnicity, gender, age, mental, physical ability, and sexual orientation. Those are the primary dimensions of diversity. They're at the core of who we are. We all have those dimensions,
Right,
okay? Then there's secondary dimensions of diversity. One's religious, spiritual affiliation, how many languages you speak, what your education level is. Are you a parent, not a parent? Have you been in the military? Right, so there are how many languages, et cetera. So there's secondary dimensions of diversity. Then there's organizational dimensions of diversity. So here at JPS, we look at what departments do you work in? What credentials do you need? How long have you been here, right? What role do you play in the organization? And we would also submit that there's another layer of dimensions for JPS. We're the only level 1 trauma center, right? We have school-based clinics, we have medical homes, we're over at 50 sites, right? So there are particular dimensions that are specific to JPS. So it's a very broad definition of diversity. In your board portal, in the resource library, you will find information, updated information on gender, which is in there, as well as age. And for the first time, if you look at it, for the first time in just 1 year's change from 2015 to 2016, millennials are the largest group of members of our workforce. All right?
No, I understand all that aspect of it.
Okay.
I'm just wondering where are we going with this?
Where are we going with?
Like, do we have specific goals relative to each one of those primary and secondary?
So I think your question, was, are we trying to, reflect number per number, percent, right? We should have a workforce that represents the demographics of the communities that we serve. And we will strive where there is underutilization to make some specific efforts to perhaps cast a net in places we've not cast before, so that when we bring a wider net, we have a more diverse pool of applicants and qualified candidates, right? So if we keep fishing in the same pond, you keep what? Catching the same fish, right? So we need to cast the net in streams and saltwater, right, rivers, et cetera, right? So we will look at where there is some underutilization and perhaps some opportunities, right, to do some specific recruiting, okay? Some targeted recruiting. The other thing too is if you looked at the engagement statements, one was in reference to inclusion. Do I think that JPS, this is an inclusive workforce, right? So that's one area. One of the things we want to do, of course, is to provide every member of our workforce the opportunity to contribute to the mission of the organization.
So like, if I look at the pie chart,
Speak up, DT.
when I look at the pie chart, right, you have 5%, I'm just pick one, Asian, and you have 6% of the workforce is Asian. Is that the cap?
No,
Okay.
no, that's how that's what the makeup of the workforce is. And that's just a snapshot as of the dates that were on that chart. Now, what I want to do, right, in a few years, once we have a few more years under our belt, is I want to look at trend lines, because that really tells the story, right? It tells the story, are we going up in the Hispanic population, in the Asian population, African American? Where are we, with the white, right? So the trend lines tell the story. Those charts are already outdated, right? Because it's as of a certain
The key we
date.
would look at, DT, is we would never discuss caps because we don't believe in them. Secondly, is we would look and say, if we are at X% of any population, what is it that is barriers to working here? What is it that there is to retaining that population?
I'm more on that side. That's why I'm questioning why we're tracking this. Because I'm looking for is, for me, when I see diversity, I also see single mom white. And where do I look it up? Or how do I see the vendors fit that criteria? It doesn't have to be the color of your skin. That's what I meant. Or it could be somebody with different gender than we used to. That's why I'm looking at background, experience, and perspective, because it's kind of blend in without using any political categories to specify,
Right.
but it's kind of bland. So that innovation and all, the common workforce and all that stuff that comes with it also as well. And I think I'm still having problems follow those, but it's okay because this is new for all of us. So I'm trying to more pick your brain to see where we are in that journey.
So you're right on target, because we define diversity as perspective. It's the exact word you used. And what shapes our perspective? All those dimensions I mentioned. Primary, the secondary, the organizational, all those dimensions shape the way we see the world
I'm looking
and
for
interact.
more cognitive diversity.
Cognitive diversity.
Diversity.
So we'll have to meet for lunch and you can tell me more about what you.
All right.
Plan for a long lunch.
Okay, but you're buying, E.T.
I think that, DT, we can get some of the information and a little bit more detail on what you are looking for and try to trend that in and add it, okay? All right?
But this is good progress. This is
It's
great
good.
progress.
No, it's
It
good.
really is an impressive program. I mean, it's excellent. I mean, it's very interesting, and I think you've done a great job with it.
Thank you. Thank you, sir.
Yeah, I want to comment that as I sat and listened to it, it does excite to see where we come in 8 years, now, 9 years.
Yes, sir.
In this whole process. I think one of the things that we miss is there's a tendency to move in your area of comfortability. And if there's not a diversity and inclusion office, then we'll still keep functioning where we're comfortable. We don't see those needs that we need to address. Whether individuals want to agree with it or not, JPS is a community component. It's a community organization. So actually, we go beyond just hiring individuals because they are Asian or Hispanic or white, but there's an education component because up until a few years, healthcare was not a dominant or pushed in certain cultures to work. But I think by having a diversity and inclusion office, that means also that you're gonna start talking to some schools and some kids and, you know, to move that.
That's the future workforce, isn't it?
That's correct. I would say that Ted Shaw and I are meeting to look at the state and develop kind of an education program in schools to promote healthcare education. The kids that want to major and go into healthcare positions. But I just would say, okay, I'll say this. When I first came on the board, I want to tell this, okay? When I first came on the board, no, I'm sorry, when Robert first hired, it might have been 2 weeks or 3 weeks after Robert came on, I went to him and I said that I thought that JPS needed to take a serious look at the workforce, that it was not diversified. His comment to me was, I thank you because where I sit, I may not have looked at it that way. I can respect that. But he took the steps to move forward. And that's why we have what we have today.
Thank you.
And I thank him for that.
You're more than welcome. Thank you.
I have a question.
Yes.
How much do you interface with the new acclaimed physician group?
So we're just starting to establish that. One of the great things that I can speak about is we have an integration right now with academic under the leadership of Dr. Elliott, and our population health and the acclaim group with Dr. Duncan and Diana Prachel. And we are looking at disparities, healthcare disparities, and so we've identified initiatives where we can integrate those efforts. And so for the first time, even though we've been collecting information, say for example on infant mortality, we haven't really looked at it by race, by ethnicity, right, by community on the north side or community on the south side. And so we are looking at that now. And so that's the beauty of that integration principle I talked about, the very last one, of integrating diversity and inclusion into all other initiatives with the organization. We are also, for the first time, in partnership with Laura Burnside and Patient Experience, is we are looking at patient satisfaction by what's called real variables. So that's race, ethnicity, and language preference. We have rolled up information, right, of patient satisfaction, but not through those variables of race, ethnicity, and language preference. So hopefully, in the near future, we will have our dashboard completed. We are building it now. We're looking at what metrics we want to identify, establish a baseline, and then be able to report to you some of that information.
Thank you, Nydia, very much.
Thank you, sir.
Appreciate it.
All right.
I think it'd be nice to have a presentation to the acclaimed.
Sure, we can definitely do that. Yeah,
Okay.
we definitely do that.
Thank you. Good
Thank
job,
you.
okay?
Thank you,
All
ma'am.
right.
Thank you for your guidance. You pushed and pushed and pushed, and it resulted in today's
Yeah,
presentation. So thank you
very
so
good.
much.
Okay. We have no further business. We've already had closed session, so I'll entertain a motion for adjournment.
So moved.
All right. Girl, we're done. Get quick.
Real quick, I do need,
Yeah, well, thank you, Mr. Early.
I need to update y'all on one thing that has nothing to do with